Mode.
Good afternoon, everyone. This is Courtney Kesterson, the CAHF Disaster Preparedness Program Coordinator. And also with us today is Jason Belden. Jason, do you want to say hi?
Hi.
He's the Disaster Preparedness Program Manager, so I'm sure that you might be familiar with him if you've been to some CAHF events or been on our webinar series before. Rich Widerynski will be joining us soon. He is the liaison for CAHF to attend all of the DRC meetings. So if you haven't joined us before, we do a brief recap of how the mutual aid system or the coalition system works in LA County. And then we get some news from Rich about the DRCs, and then we will be discussing the upcoming county-wide exercise that will be taking place in September and other opportunities between now and then. So,
good morning.
Hey, Rich. Perfect time.
Good afternoon. Sorry.
Alrighty. So we're pretty much on time then, so I'll just go ahead and get started. If at any time you can't hear the audio or see the screen, just let us know in the questions box. That's kind of the only way that we know if
things aren't going right.
If things are going well. So we'll get started here then. If I can click. There we go. Alrighty, so again, we already introduced ourselves. So if you have joined us before, you might have seen this slide and a couple of these starter slides, just to recap for any new people joining us. So in emergency management, these are some of the acronyms that you'll see, at least in our webinar series, and I try to type them all out so it doesn't turn into the alphabet soup. But again, this might be a good screenshot to take, and we also have a list of the acronyms on our website as well if you really want to kind of dive into those. So this webinar, we will cover, again, the updates from the Disaster Resource Centers with Rich, and then we are going to cover all of the dates that you'll need to know in the next couple months for you to be on board with LA County's medical health exercise program. And again, this is different from the Great Shakeout, so if you're planning to participate in the Great Shakeout as well, just know that this is a little bit different. But again, if you have any questions about materials for doing an earthquake exercise, you can email us afterward as well.
Yeah, and the folks at the Earthquake Alliance, which are the people that run the Great Shakeout exercise and the website shakeout.org, are really interested in incorporating more of healthcare into this exercise process. We've got a build your own tabletop exercise toolkit that's on our website. So if you're interested in how to adapt that so that you can do the Great Shakeout as one of your exercises, or in addition to the exercise that Los Angeles County and the state is going to do this year, certainly it's a great opportunity. Maybe November the schedule doesn't work for you. Maybe flood is, maybe you want to practice something else. But certainly there are options out there for exercising. The one full-scale exercise that's community-based is the Los Angeles County exercise. That's the one that we know for sure will cover the CMS requirements. If you do the Great Shakeout, it does not necessarily meet the community requirements unless you're coordinating your exercise with another agency like EMS or somebody else. Doesn't mean you couldn't, but you would have to do some additional work to do that. So.
Right. And before we get too far into our presentation today, I just wanted to draw everyone's attention to the handouts for today's session. So today, if you look under the handouts panel for our GoToWebinar session, you will see an agenda for today's webinar, and that will have a lot of the emails and links that we will be showing you on our slides, so that way you can just download the PDF and you have those clickable links. And then also there is the continuing education evaluation if you want an hour of CE credit for this webinar, and that'll be for NHAP and BRN, just 1 hour. And then we have some other PDFs on there that we will cover in the webinar, but just know that you have a lot of different stuff to look at there. Probably the most important is going to be that evaluation for returning it to me, and then the other handouts are kind of just for your own reference. So, alrighty, so, oops, let me click back over to here. So if you haven't joined us before, LA County does things a little differently than some other counties. So normally a county has a healthcare coalition where all 17 provider types are supposed to come together and work on preparedness plans. But because of the sheer size of LA County, they have kind of broken that up into a dozen or so sort of districts that are led by these disaster resource centers. And so this is a map here, kind of an overview. And then Rich, he attends these meetings and kind of collates that information for us, and we pull out the relevant stuff for skilled nursing. So if you've attended these DRC meetings before, some of our long-term care providers have kind of reported back that it's hospital-centric. So this webinar is designed to kind of boil that down for you into an hour.
Yeah, and take the information that's applicable most to long-term care. There's sometimes there's some stuff that just doesn't get covered in the DRC meeting. So
right. Okay, so Rich, I'm going to cover the DRC meeting updates right now. So these are the ones that have occurred since our last webinar on May 15th. And then our next slide kind of starts diving into some of the highlights that Rich reported back to us. Rich, did you want to kind of add on to any of these, or would you like me to kind of cover what some of these sort of implicate for our listeners?
No, you're quite welcome to just read them or whatever, however you'd like to do it, Courtney.
Okay. Well, so for the first one that we see here, so for the Power for Patients program that LA County is working with on some of the utility company providers. So they're going to start doing assessments of your power capabilities and capacities at your buildings. So like I just said, a lot of these meetings are hospital-centric. They're going to be doing the hospitals first. But over the course of the next 5 years, they will be trying to assess all healthcare facilities in the county so that they can get more information on how to support the providers when they're doing these public safety power shutoffs. And if you haven't heard about these public safety power shutoffs before, this is a program that the utility and the power companies throughout the state are doing to try and mitigate wildfire risk, right? So when there are certain conditions for wildfires, such as high temperature or sorry, we're having something here. Or high winds, they will actually sort of de-energize entire sections of their power grid there.
Courtney?
Yes.
Let me interrupt. I got an email from Andy Ward who indicated that Glendale today, 2/3 of the city has been impacted in regards to a power failure. So many nursing homes, many long-term care facilities up there, I tend to think are scrambling. And this just came over, I don't know, maybe 15 minutes ago, half an hour, something like that.
Wow.
Well, thanks, Rich. Courtney makes some great points. We often take power for granted because when I don't want to date folks, but some folks can remember, rolling brownouts and times when power was not necessarily a guarantee like it is now. We've come to build our physical plants and build our operations around the ability to have power, to power not only the lights and the fire alarm systems, but our medical devices and our health records and all these other things that until you lose power for a sustained or long period of time, it's hard to gauge what it is. So, a good exercise for the administrators would be to just flesh out what it would be like after 24 hours without power. Just put yourself in that position and then go from that point to start planning. Like, how am I going to get more staff here? Are my staff going to stay? What if they're impacted by those things? All that kind of stuff. I did want to mention on the Power for Patients project that Los Angeles County EMS has signed a grant with a researcher to research this stuff. We're going to be working with those folks, but there may be times when we reach out to buildings to ask them for information as a part of this research to better understand, energy supplies to long-term care facilities. So we may reach out if you get a call from us. If you'd like to volunteer, certainly let us know. And then the last bullet point, Rich, I know we've gotten a lot of feedback from you and from other folks that go to the DRC meetings that have emphasized that not enough facilities are trained in how to activate their EOP or what that even means, and then managing an event through the incident command system.
Right.
CAHF is one of the developers of Nursing Home Incident Command, and we have tons of free resources for that. We'll talk about it in a little bit, but we have hearing those complaints and those concerns from providers. We're going to do 2 free classes for Incident Command, one in October of this year, one February of next year. We'll get to that later, but we will cover that in a little bit. So.
Okay.
And then, not to skip over this third paragraph here about the medical surge supplies. So if you are going to participate in the countywide medical health exercise in November, this is something that you can submit resource requests for. So say if you're playing out the scenario at your facility for the scenario this year is flooding, if there's a certain item that you want to request from the county, of course, since it's an exercise, they won't actually send it to you, but just be thinking, what sort of things outside of my own scope of my EOP would I need help finding if we actually did have to shelter in place or if we did have to evacuate.
And even if you're asking for something basic, I think the point we want, that the county wants you guys to understand is that there's a process, and that process is the same no matter whether you need a saline bag or you need a ventilator. There's a medical and surgical supply cache. The process to ask for those resources is the same, and they want you to, when we do the exercise, they want you to practice that, to actually physically fill out a resource request and to send that in, or to log into ReadyNet and respond via ReadyNet. So we'll talk about how you can do that in a little bit, but these are some of the things we want to get all the providers in the habit of understanding how to do it. So when the time comes, if you're ever in need of that stuff, it's not unfamiliar to you. So. Right.
And before we move on to the next slide, I can see that we've had about 10 people hop on since we started. So again, just drawing everyone's attention to the handout section where you can find the evaluation, the agenda for today, and the other materials we're going to be talking about all underneath the handout section. Okay. So if you haven't completed your tabletop exercise for your calendar year, you can still try and be a part of your local DRC's tabletop. So they will be using the same scenario, I think, as what will be done in November for the full scale, which is the flooding scenario. So these are the ones that are coming up. And if you want to participate, just make sure that you actually coordinate with the DRC coordinator. And all of these emails and this same information with the dates is on the agenda under handouts. So you can click on those email links directly if you download that PDF. And just make sure that they have space and get the right address, because we've had a few times before people went to the DRC hospital, but it's actually somewhere else. So just make sure that you confirm with them directly, because they're the ones facilitating it. So.
Yeah, and the DRCs want to make sure that the people that come to that DRC tabletop exercise are assigned to that DRC. Right. If you don't know what DRC you guys are assigned to, email either Courtney or myself at the end of the webinar, and we'll send you.
We'll look it up for you.
Yeah, we'll look it up for you. But the reason being is because there may be some DRCs that are more convenient for you to go to from home, but the facility that you work at is assigned to a specific DRC, and we need you to go to that one if you're going to go to the tabletop. So.
Guys, I went to a tabletop exercise on at PIH the other day. Isabel Sanchez has moved on to a position at the EMS, and just wanted, and I see the date here you have is September 18th. I can't help but think that it already occurred, but let me just say this. It's very, very important for facilities assigned to the specific DRC to attend. And the reason I say that is because they throw out some incredibly real life scenarios, as they did at the PIH recently. It's downright scary, but at the same time, we have to prepare, obviously. And one day, this issue of disaster is going to come knocking at our door, and we have to be ready.
Right. Thank you, Rich. So I think then I will send out an email to the attendees, and we'll go find the correct person for PIH. So if you are in Whittier or the surrounding area, just stay tuned for that one. If you do need to find a tabletop exercise before November, shoot us an email, and we're going to talk some more later in the webinar about some other training opportunities as well.
Yeah, and just so you know, the tabletop exercises, in order for you to do a tabletop exercise, you do not have to go to these meetings. This is great because the stuff is already prepared for you. But if you're willing to put in a little bit of work, or if you email Courtney or myself, we can help you prepare your own tabletop for your facility itself. It's not as difficult, to come up with the scenario and things like that. The hard work actually starts after the exercise, when you're, discussing the issues within it, and then what are you going to do to correct it. And that's kind of where the work starts. And whether you went to this exercise or whether you did your own, you would still have to do that. So.
Yeah, I will say, if you want to practice integrating with your community, then going to these tabletop exercises is good. If you want to use your tabletop to train your own staff directly, then you'd be better off making your own tabletop exercise and customizing it to your facility. Because when you go to these DRC trainings or tabletops, you as one person are representing your entire staff. So it'll play out as if your staff, did everything right, but sometimes when you go back to your building, your staff doesn't know what they're actually supposed to do. So that's something to keep in mind. And if you do want to try and put together your own tabletop exercise, we have some toolkits for that and some videos. If you go on our website, we have a web page for that. So, all right. So here, continuing on with the dates for the tabletop exercises. So I will say that September 26th is right after the participant seminar. So if you really want to kind of connect the dots, go to the participant seminar on September 24th. And we have a slide about that, but it's going to be a morning session for long-term care. So it's only a half day for this year. I know that in the past they made it a full day, so it's kind of nice. You can be out of there by lunch or by 1 p.m. or whatever, and not get caught up in traffic. The second half of the day is going to be for hospitals and people who have been doing tabletop exercises for like 10 years or a bit more advanced. So if you want to stick around, just let them know so that they have the right amount of seats. But they're really shooting for long-term care to be there in the morning. And then, again, if you want to go to these, just make sure that you email the coordinators. Rich, did you have anything else you wanted to add on to there before we go on?
One of the things that Jason talked about a little bit ago was the EOP and the incident command system. And that is to say, CAHF put on a magnificent in-service at the conference in Anaheim not too long ago about the business continuity plan. And that has to be folded into this entire thing as well, from the perspective of you got to track what you're expending during a disaster, otherwise you won't get paid. You have to track your staff costs, you have to track your material costs in terms of equipment and things of this nature, but it's very, very important. And I know that CAHF is going to be probably doing more in-services on this in the future, but it's one additional part of that EOP, ICS, and the business plan.
Yeah, and it can't be, my sincere hope is nobody ever really has to worry about business continuity.
Right.
But it's probably one of the biggest things that businesses struggle with on the backside of natural disaster. I mean, there's tons of verifiable results of most of the facilities, or a lot of the facilities that were impacted in some of these natural disasters just never come back. The business is gone and it won't come back. So it's, after we have a natural disaster, one, how do we continue our business, so that we can provide safe care, but also so we can have our business in 5 years from now or 10 years from now, and we're not stuck in the sink. So there are many financial pitfalls in disasters, and to understand where those lie before the disaster happens, will help you be more successful managing the event, because you're thinking about the end while you're doing the response to it. So.
Right. And before we move on to our next slide, I can see in our questions box that Elaine Forsyth, who is our contact at LA County EMS, is giving us some updates on that PIH Whittier contact that Rich was discussing. So if you are in the Whittier area, and I will send out an updated agenda with the correct contact information. The DRC coordinator is now carol.snyder@pihhealth.org. But again, I'll send that out to everyone. So thank you, Elaine. And let's see, just making sure. So we have, and she says also that the PIH Whittier tabletop is still taking place on September 18th. So that will stay the same. And then, sorry, Rich, did you have something you wanted to say?
Yeah, besides Carol Snyder, the new lady over there, or another person who works at PIH, is Melissa Johnson.
Got it. Okay. I will get that updated and out to everyone. So thank you. And for our attendees, I apologize about that. And we will get it all sorted. We have a couple more questions on here already, so I'll go ahead and address them. Does the Great Shakeout meet requirements when it's done with other sister facilities like 3 group homes?
So that is a fantastic question. It's covered in the interpretive guidance from CMS. CMS has essentially said in instances where community-based exercise is either A, not available to you, or B, not appropriate. In other words, let's say you're in a ICF facility and the exercise is on terrorism or dirty bomb, and you go, well, that's not on my hazard vulnerability assessment, and there's no reason why I should be exercising for that. The Great Shakeout, if you live in earthquake country, earthquakes on your HVA, if you coordinate like simulating evacuating one and the other facility or the other home simulates surging those clients or those residents into the home or into the facility, that in itself constitutes, now you can do it as a full scale, you can actually do the movement, or you can do it as a tabletop. Either one would work, and both would work as far as CMS is concerned, as having it count towards the community-based full-scale exercise. But that's only if you're doing it with other multiple providers. So you would have to have a few folks doing it. But we've heard a lot of people that have maybe 10 homes or 10 facilities, and they'll simulate 1 or 2 of them evacuating. The other 8 of them would simulate surging those people. How am I going to get them into the building and things like that? Yeah, so 100% it could count. You would have to write it up that way, but if you have questions, email me and I can work with you on how to develop a scenario that would work for you.
And then the second part of Gabriella's question was, does attending the tabletop with the DRC satisfy ETAG 009 collaboration with partners?
It's a part of that. So the collaboration with your response partners and your planning partners is an ongoing requirement. So it would generally, when we talk about these DRC meetings, attendance to the DRC meetings is one way to meet that planning and collaborating with your with local authorities. This, what you're doing right now, is listening to this webinar counts as you're planning and collaborating with your county. What the information that we're giving here in these webinars is the same as they're giving at DRCs. We're just not covering the hospital specific stuff. So if you're doing one of those two, you're meeting E9. Just keep copies of the sign-in sheets, keep copies of the agendas, have it in some form where it's easily accessible for a surveyor when they come into the building. I don't know if you want to have a tab for each, like if you had a compliance binder with a tab with all the relevant paperwork behind each e-tag. That's something that I've heard people have a lot of success with. But to answer your question in a roundabout way, yes, this what you're doing now counts as E9. Attendance to the table's top, it would count towards the exercise requirements towards the end. I think it's E39?
Yeah.
Something like that. I'd have to go back and look at the list, but E9 is more attendance at the DRC meetings or participating in the webinar.
Yeah, and that's why we put together the agenda so that you have a kind of like a paper trail as well. Okay, so hopping back into our webinar, thanks everyone for hanging in there with us. So let's see our next slide. So kind of just going through some more of the opportunities that providers will have to be involved with LA County events in the next couple months. So this is a workshop that's being offered on August 5th, and they're going to cover how to kind of identify different threats and when you're doing interviews, how to try and put together something like a violence prevention or a workplace prevention program. And so this is a topic that we've actually seen popping up as well because, well, Jason, do you want to explain?
Yeah, I can talk a little bit about that. We've heard from multiple providers, and especially in Los Angeles County, that have been receiving inspection visits from the CAHF High Risk Enforcement Bureau, or some crazy acronym like that. And essentially, they've identified as healthcare, all healthcare, as being one of the high risk employment practices. And with that said, they require every healthcare facility in the state to have a workplace violence prevention plan that's different than having identified workplace violence in your disaster plan. So it's pretty common to have identified workplace violence, but there are very specific requirements from CAHF for this workplace violence. And so anything that you can do to educate yourself on how to do the vulnerability assessment specifically for workplace violence, that's different. We've had people take our template that we have done for disasters because it has a section in there on workplace violence, and the OSHA inspectors have said that's not adequate. It doesn't meet the minimal requirements from CalOSHA. If you guys have questions about it, I don't want to drag this down, but certainly there's training stuff that you can go to talk about that, or you can contact me directly, and I'm happy to explain that to you as well. Hey, Rich, is that your phone?
Yeah, sorry about that.
All right, I got him muted. Sorry about that, everyone.
Okay.
Okay.
So we go on that next slide.
Okay, let's see here. So also coming up, so the day after that workplace prevention workshop, which takes place on August 5th. And by the way, actually, let me go back. Oops, not forward. So if you want to register for this violence prevention workshop, the registration link is in the agenda handout section. And I'd recommend going and registering for that as soon as possible, because that is open to all healthcare provider sectors. So there will be a lot of different people trying to sign up for that. Okay. And then the day after that workshop, so August 6th is the next chance that you can have to be a part of ReadyNet's training webinar, and they are offering that at 3 different times, so 10 a.m., 2 p.m., and 8 p.m. If you want to train multiple shifts, that's a great way to kind of introduce them to that. And again, you can register for this. I put the link in the agenda under handouts as well.
Yeah, and do we have more on ReadyNet later?
Yeah, we have.
Okay, I'll cover it when we get to the next section.
Yeah.
All right.
Okay, and then one more training opportunity coming up through the LA County Public Health or DRC program is this large sort of boots on the ground exercise that the Long Beach and St. Mary's DRC is coordinating at the Los Alamitos Joint Forces Training Center. And they were originally looking for something like 200 volunteers, so I'm sure there's still room if you'd like to kind of dive, feet first and see what how they kind of run it at the hospital level. And I put these other pictures here because they're going to be doing the moulaging or the fake blood and injuries. So if you want to get super involved or send a staff member, it'll be a lot of fun, I think. So I wish I could go. But again, if you want to get involved in that, you can email Kathy Dollarhide at St. Mary's, and her email link is on that agenda handout as well.
Yeah, and if you guys don't know Kathy, if you've not had the pleasure of meeting Kathy, she's a go-getter, and she also teaches Stop the Bleed and some other stuff. She's a great teacher. So if you're ever wanted to go see what a large full-scale exercise looks like, that would be a great one to go participate in. So.
Yeah. She presented at our disaster preparedness conference in February. If anyone attended that, you have probably already met her.
Yeah.
Okay, I'm going to take Rich off mute now and see. Rich, do we still have you with us?
Yes, thank you. Sorry about that with the phone.
Excellent, no problem. It happens. Okay.
I wanted. May I interject in regards to ReadyNet? Are we going back to that one in a moment?
Well, we're going to talk more about ReadyNet participation, but if you want to talk about specifically the monthly training video webinar, yeah, for sure.
Well, I don't want to try to talk about that, but what I was going to talk about was the fact that there's 2 ReadyNet systems, and in the past few months, I'm going to say 3 or 4 months now, we've been informed that ReadyNet for hospitals, that a satellite by the name of Spaceway satellite system is coming out of the sky, literally falling out of the sky, and a new system by the name of Jupiter 2 is being, I guess, put up there, and it's being used by ReadyNet. And the issue of getting phones and expending thousands of dollars is always talked about at the meeting. And I always say, and this does not affect long-term care. Long-term care is going to still be, IT based. And so don't be confused by that if you hear it and like somebody's going to bill you for a couple of grand and you're going to get a couple of phones and that type of stuff. Not the case. That's part and parcel. The acute settings are going to go through and they get special funding for this. So I just wanted to bring that up because to avert some confusion on the part of people.
Right. Yeah, I did hear that. So for everyone listening, just to recap on that, ReadyNet is upgrading some of their satellite services, but again, like Rich said, that'll just apply to hospitals. So
I think eventually it will apply to us. I think, but for the moment, it's going to be hospital only. If it turns out that new piece of legislation makes long-term care core members of healthcare coalitions, then ReadyNet's going to have to add them on to that. But for the time being, it's good to know that the long-term care won't be affected by it.
Right.
Correct.
Alrighty, we saw that slide. So now into the second portion of our webinar. So we talked about what's going on with the disaster resource centers. Now we're going to take a look at how to gear up for the participant seminar. Roy, I saw that you had a question about that, so we're going to start answering that now. So we talked about how the DRCs are doing their tabletop exercises currently, and now we are gearing up for the November exercise. And here's kind of just a graphic that we've used before to kind of show that cycle. And then this is the save the date that LA County sent out for the participant seminar. And this date here I added on there because at the recent meeting I attended, we were talking about how to register people. I don't believe they have the registration link ready yet, but when they do, I will send that out to everyone. I will, I'll hound you all and make sure that we get you signed up, but it is going to close 2 weeks before the actual event. So if you can put September, just a reminder on your calendar on like September 9th, make sure that you've signed up for it, because they're rearranging some of the different portions or sectors. So getting registered on time is going to be super important. Trying to register as early as possible. So I think that link will be ready in maybe like the next week or so. So again, just keep an eye out for that email from me, or if you're signed up directly with them. Just know that the participant seminar, they're going to be covering how to use all of the different documents that the county prepares for providers, and where to look in all of those documents for what long-term care is expected to accomplish. And then, so if you attend the participant seminar, you still need to register for the actual exercise itself. So on October 31st, that's the cutoff date for registering for the exercise.
And it's important to note, guys, if you're going to participate, you have. Don't even wait. Just go sign up now, because the participant seminar is going to fill up very, very fast. Mm-hmm. It will be completely sold out. So if we're not there, somebody else from another healthcare provider type is going to be filling that seat. So if you're going to do it, you got to sign up now. Sign up for intent to play, or intent to participate with the statewide medical health exercise. If you're going to do it, sign up early, because they're going to close the signups and you're going to be out of luck. So.
Yeah, and so unfortunately I don't have those links ready from LA yet, but we will make sure that gets out to you. And then as you can see, there's the exercise evaluation conference afterward. So if you want to get the county kind of like walk through writing up the after action report, that's when they will cover that, and then you'll have another month to actually turn those in. So if you turn in those reports, then that also kind of counts as your collaboration and cooperation as well. So we talked about that ETAG 09 earlier, and so yes, participating in this kind of helps you with that, but it's sort of like an entire process as well, and it's year round. So thinking back to that circle graph that we just showed you, all of that is included, and understanding the process and being able to explain that to the surveyor is ultimately what they're looking for. All right, I'm going to check the questions panel real quick just to make sure that we, if we have anything.
Okay.
Hold up a second, just bear with me, everyone. Okay, so Elaine Forsyth from LA County is giving me some more feedback. So there's going to be space for about 50 long-term care registrants. And then all different sectors will have a separate registration link. So when we get the link for long-term care, I'll make sure that gets sent out to everyone. Let's see. And if you need to email me about something, you can find my email on the evaluation under handouts. So I'll come back to the questions at the end of the webinar. Just want to make sure that we get through everything because we are kind of speeding through this hour. And let's see. So again, just recapping, I think we already explained this, but on September 24th, long-term care will be in just the morning session, and we now know there's only going to be about 50 seats. So I think that if we can just send one representative, that way we can get as many buildings in there. In the past, we kind of just said, please, everyone come, but as more and more people get involved, space is going to be impacted. But again, I'll make sure that gets sent out to everyone. Oh my, sorry about that. I clicked a little too aggressively there. How do I go back? Okay. So this slide kind of just recaps the difference between the full-scale exercise that needs to be community-based and then the tabletop exercise. So if you attend the DRC tabletop exercises, they will probably be using the same scenario as what you'll be using in the full-scale. So that's nice because you kind of get to go over it twice and kind of familiarize yourself a little bit more. And then again, this is just some kind of intro knowledge that maybe some of our attendees have seen before, but just to illustrate kind of the difference in the tabletop and the full scale. But again, you're still using a scenario-based discussion, and you'll want to do some kind of hot wash or debrief afterwards, which if you attend the exercise evaluation conference, that will sort of accomplish that for you as well. So the county really does set you up to kind of tackle all of these major points. And then these webinars, we try and just provide that support and that general knowledge of what an objective is, how do you actually use some of these documents. So Elaine is sending me the most recent version of this document here, which is the resource request. So if you are already on ReadyNet, the resource requests, I believe you can submit them through ReadyNet, but you can also submit them through email. If you really needed to, I guess you could fax it in as well. So this is a good thing to practice when you're going through the exercise, because this is how you would request things when you're actually going through a disaster. So make sure that the first time you use this form isn't when you're like really stressed out and like an earthquake's just happened. Go ahead and practice it, familiarize some of the other staff with how to fill one of these out, and they will cover how to properly fill this out at the participant seminar. But essentially, when you're requesting the resources, try and provide as much detail as possible. So if you need aspirin, don't just write aspirin, write I need 5 bottles of 200 tablets at such and such.
Right. Yeah, if you have a ventilator, you have to be really super specific for some of these things. So I think we made our point. Yeah, you know, if I want Motrin, I want 800 milligram, not 200, right, or something.
Right, and then each facility has like a certain code that you'll need to put on here, so you should be able to get the code for your facility at the participant seminar, or we will be able to give that information out to you if you need it as well.
Yeah, I'll have to
exercise.
Yeah, I have to ask Elaine. I don't know if they'll give that out, but if they do, that's great. But I think at some point we'll identify how you can find out the information for your buildings.
Right.
Yeah.
And then this spreadsheet on the right-hand side, this is our measles. This is one from a past year because they haven't released the 2019 one yet. But again, measles, that stands for the Master Scenario Events List. And then again, you will be using ReadyNet if you're already on ReadyNet. If you still need to sign up, go ahead and email me and I'll get those documents to you. And we want to do that as early as possible as well because it takes ReadyNet a little bit of time to create your account. And then, if you try and do that like the week before the exercise, it's probably, they're going to be so impacted. There's no guarantee that you'd be able to get online. So earlier is better. Email me to get on ReadyNet if you still need to. And if you don't know if you already have an account or maybe a previous administrator, you don't know if they made an account, again, just email us and we'll figure it out for you.
Do you have another slide on ReadyNet? Can I, do we have?
That was just it. Do you want to say anything else about ReadyNet?
So Elaine and I kind of had some discussions about, so we've encouraged people to sign up for ReadyNet because we know in a large-scale natural disaster, that's the most efficient way to communicate with the county. It's the easiest for the county to be able to minimize the amount of time that they do finding who's impacted and what those impacts are going to need. So with that being said, it's a communication platform between you, the facility, and the county. And we said, well, we've got all these new people signed up. Let's test to see how many people respond to a drill or a bed poll on ReadyNet. So we sent out a drill and a bed poll to every single provider that had signed up for ReadyNet. And out of the 200 plus providers in Los Angeles County, only one provider, one out of 200 and something, participated in the drill. And that's an abject failure. if you belong, if you're on ReadyNet, it's not, you don't just sign up and quit. That's not it. It's an ongoing thing. We ask that take 5 minutes or 2 minutes to log into the account. Make sure that your contact information is correct. And when you get the drill, respond to the drill. I understand that people get busy and things like that. But this is real life stuff, folks. If that Ridgecrest earthquake had happened 100 miles south of there, we would have completely failed at being able to communicate with the county. If that's why we sent out that bed pulling request. So it's clear as day to me that it's very important for you guys to be able to do that, to know how to work the system. I'm not saying you got to be experts, but at least answer the bed pull and do that. When the large scale earthquake happens, we're going to need everything we can do to minimize the impact, because there's going to be hundreds of facilities that are going to be hurting. And so the better we can do at responding to that, because what's going to happen is that information is going to get back to CMS. Not from us, but from somebody who's going to tell CMS, that's great. You guys have done fantastic and you've signed up for this, but you don't actually use it. And if nobody's using it, then that's a failure of that specific type of tech. I was disappointed in our performance, and hopefully the next time we run a drill, we do much better. But if you guys see that notification from ReadyNet, answer the drill.
Yeah, well, it was an unannounced drill, but we did want to just gauge how many people received the notifications. So we are going to be doing another no notice drill sometime in the next month, I think, just to kind of see.
I think Elaine and I have figured out that no notice maybe is not the greatest thing. So we'll maybe this time we'll work on doing we'll schedule a date so everybody knows on that date to look for the thing. And that way, if you don't get an email, you go, well, maybe the account is, I have the wrong email address in there, or I have the wrong phone number in there, or something like that. So I think we'll kind of back it up to get more people involved. I don't want people to feel bad, but I want you guys to know that it's important to participate in the drill. So.
Right.
Jason, this is Rich. May I interrupt for a second? Yeah, we continue at every meeting reminding people that the first thing that disappears when a disaster occurs is communication. And ReadyNet is our form of communication. I mean, we've got our cell phones. Sometimes they're going to be, broken down. The landline's going to be shot, but ReadyNet will be there. When in recent days there's been on HBO a movie about Katrina, and it's not a movie, it's real life stuff. But one of the first things that occurred in that terrible tragedy was, again, communication. People couldn't talk with each other, and as a result, lives were literally lost.
Yeah. Yeah, and we talk a lot about the lasting impacts of some of the large disasters. If you attend some of our larger trainings, we spend a little bit of time just talking about the long-term trauma and impact on the long-term care residents' overall condition when they're going through disasters like that. So the more incorporated and integrated that you can be in the coalition and having access to that resources, the better off your residents and ultimately your staff and the longevity of your business as well. So, so I know we talk a lot about protecting the life safety of your residents and all of these different things that you need to be doing, and we realize that this is, kind of other duties as assigned for a lot of these people that at the long-term care facilities that end up handling the emergency preparedness program. But just remember, ultimately, it's not just for the residents, but for the staff and for your continuity of operations as well. So, did you have any more comments about this slide?
No, just okay. Next time if you see ReadyNet, and then if you could like a to-do list, go log into your ReadyNet account to make sure that the contact information is still up to date.
Yeah, so maybe we won't do a drill before the upcoming events that we just talked about, because there's already a lot going on in the next couple
there's so
months.
much that's stacked up. I think we may wait until Q2 or Q3
So like spring of next year?
Yeah, beginning of next year. So
possibly. So we'll send out more information about that once we get it ironed out. But again, just at least check that you have the right password and login information, and maybe check under the preferences that you've checked all the boxes for getting those texts. Maybe check out ReadyNet's phone app as well. So there's a lot of different ways to make sure that you're getting the notifications. But overall, I think we're wrapping up pretty quickly here. So one of our last slides here. So this is a flow chart, and Elaine let me know that there's a more updated one of that. So again, I'm going to send out all the handouts again to everyone that attended.
Yeah. So what we're going to do is Elaine and I and Terry Creamer work to create a flow chart in terms of who do you contact and how do you contact them during a disaster, because you guys may not always be at your building, but what about your front office staff? Do they besides other than calling you to call the cavalry in, do they know who else to call? So we've developed a kind of a one-page flow chart that talks about who and when to call, and who and when you should be relying on your own resources, and when you should be asking for help from other providers, and when and how to ask for help from the county. All that stuff we've done on a flow chart, we're going to laminate those and we're going to send them to every building. And I want every building to make a commitment to put this by their desk that's manned 24 hours a day. So whether it's a nurse station or wherever your knock shift, whoever answers the phone, I want it to be there, because those are the times that we're concerned that folks don't know how or where to ask for help. And it's not when you're in the building, because we know that you guys know all this stuff, but it's when your knock shift is got 7 people on staff and they're worried about having to evacuate a facility. Like, how do we access those resources quickly? So we'll send that out. We've got to sign a contract with a printer to laminate them and print them all off, but we're going to send them to everybody in the county. So.
All right. So that is our last slide. And so again, this is available as a handout, but I'm going to email out again all of the correct forms to everyone. And one more slide. So even more dates. I know we're just throwing a million dates at you, but we have, so these are some CAHF events. And so the LA Rap session, do you want to mention what that's going to cover? Joe
Diaz, who runs the rap session, has asked us for just an update on the e-tag compliance. What are the most common tags being cited, and best practices for how we can avoid getting those deficiencies. That'll be a small portion of the rap session. Those of you guys that go to the rap session know it's really more about listening to public health come talk, for a couple hours about surveys and stuff like that. So if you're already going, that's great. We're going to be presenting there. If you're looking for something that's just disaster specific stuff, we're going to have a free training October 24th of 2019 at the Hilton in Glendale. CAHF is also doing an infection control training the day before that. So, it's we're trying to combine resources. But in any case, we're going to do a training on NICS, Nursing Home Incident Command System, which is based on ICS, or Incident Command System, which is the standard kind of
operating system.
Management system for disasters in the United States. ICS is used in a lot of other countries, but for us here in the States, every single response entity that I'm aware of operates with ICS. So we'll train you on what that is, how do we manage by objective, what are the roles, what are the benefits of having pre-assigned and delegated duties. There are a lot of benefits and reasons, especially when you don't have a lot of personnel or staff or resources. You got to kind of, minimize the amount of time that you spend there thinking about what you should be doing. And we'll talk about how that stuff is kind of pre-planned out for you with checklists and stuff like that. But,
and for the tabletop exercise, we're going to be using the same scenario as the county, which they will be exercising on November 21st. So it'll be a good time for you to come and complete a tabletop exercise if you can't make any of your DRC tabletops, or if they've already had it and you missed it. It's free to attend this one. You'll get 5 hours of continuing education and lunch.
Yeah, it's a full day class. I believe it'll be 9:30 to 3:30, I think.
Yeah, we usually try and get people out before traffic gets really gnarly, but so this is a good training for administrators, for any of your operations people, for your staff developers, because the incident command system, it incorporates all your staff, so it's going to be something that all of your staff will need to know. So whoever's in charge of orienting your staff should probably know that as well and be able to pass along that.
Yeah, but if you have some DSDs that have time to come, that's a great thing, because they're going to be, hopefully you take this information back and you use it as a basis to train your staff. And so if you have a DSD that attends, they're going to get, kind of a train the trainer book so that they can go back and teach your staff. And that's really ideally. So we want administrators, DSDs, DONs, people that are going to be incident commanders or going to be command staff.
Yeah,
that kind
shift
of stuff.
Leaders.
Staff developers.
Yeah.
Right. And if you've attended our NICS training in LA County before, I don't think we've done one since October 2017. So it's going to be the same concept, but we're going to try and put in some more activities so that you don't get tired of me and Jason talking for so many hours. But yeah, so we really hope to see you all there.
And if you don't make, if you're not able to make that, because we have a finite number of spaces for that training. I think the room holds 80 people. So if you're not able to make that, we're going to repeat the same thing in February of 2020.
Right. Yeah, but that one might be down outside of LA County. So October 24th is your opportunity for the LA County only exercise, and that'll be in Glendale. We just confirmed the space for that, so the registration link will be up soon. Anything else?
Oh yeah, and the February one will it could be in Los Angeles County, it could be in Orange County, it could be in Riverside County, but it will be in in the Los Angeles greater Los Angeles area. So, it will not be San Diego, and it won't be anything north of there. So.
Right. Okay, so that brings us to our last slide. Our next webinar is going to be on September 17th. Again, if you joined us after I made the opening announcement, your evaluation form is under the section for handouts. And then we usually post these webinars afterward on CAHF's YouTube channel. So if you want to go back and rewatch any of this, you're more than welcome to.
Or any of the other ones.
Right. And so I'm going to check the questions panel right now super quickly. Let's see. Oh, we've got quite a few. Okay. Okay. So I don't see any more outstanding questions. Let me double check here, just make sure I didn't miss anything. Okay. So Raymond said, can you let us know when there's a drill on ReadyNet, as long-term care is not always logged in? Yes, so we are going to announce the next drill we do. We may not do another drill until after the start of the year, just because all of the exercise stuff with the county is going on, so we don't want to confuse people. But yes, we are going to announce those so that long-term care has some more chances to kind of stay involved and keep that login information fresh and ready to go. Let's see. Oh, but Elaine from LA County is saying they may just do a test on ReadyNet just to see.
On the date of the exercise or before that?
Before then.
Okay.
So just double check your notification settings on ReadyNet so that if there is a test, you'll see it. And if you can't answer it, go ahead and answer it. because again, they keep all of, you should be able to kind of like print out your participation and then save it for your records for your next survey. So the more involved you are on ReadyNet, the easier it is going to be to document all that stuff. It basically documents it for you.
Yeah, and hopefully the impact to your guys' workflow of your normal day when you get this bed pull request should be the time it takes you to log into the website and to click a button. It literally should not take more than 1 or 2 minutes. So that's the kind of the benefit to this. It's not one person making phone calls to each facility, which could take multiple days to get all the information.
Right.
It's ideally so hopefully the impact to you is minimal. It's 1 or 2 minutes when we're doing a drill. So yeah.
Right. And let's see, our next question was the registration for the NICS training sent out? No, it hasn't been sent out yet because we just kind of reserved the space maybe only a couple days ago. I don't think we've actually even signed the contract with the hotel yet, but just
we know. Yeah, we know we're going to be at that hotel.
It'll definitely be on October 24th. Yeah, at the Hilton Glendale. So we'll get that information out to everyone.
And we will also post a link right on the CAHF Disaster Prep website that will have a link to the registration. So you can click on the banner and go right to the registration page.
Right. And then our last question for today, can ReadyNet send out text to cell phones?
Yes.
Yes. So that's the benefit of downloading their phone app. And then I think you can set that as well from the desktop version. Yeah, you should be able to set in your notification preferences whether you want to be contacted by text, and it will send you a thing. Now, I don't know about ReadyNet. I know with EM systems and some of these systems, when you put in your phone number to have a text notification, it has to be an email address that's it's an email to text. And so sometimes there's a specific number or a specific email address that has to be included with your phone number. Yeah, you have to put like at AT&T.net or at T-Mobile whatever.
Right. So for whoever your phone provider is, I would find that if you got Verizon, you could just put email to text Verizon, and it'll give you the prefix. So it'll be like your phone number at Verizon.com or whatever it is. So, but yeah, yes, there is the ability to text. So.
How do you sign up for the disaster drill at the Los Alamitos military base? So you will want to
email Kathy Dollarhide.
Yeah, email Kathy Dollarhide, and you can find that link under the agenda. You should be able to click on her email address there and send her an email. And then Ray said, I have automatic reply on my email. This is true. We are actually broadcasting from Monterey County right now, so I am technically out of the office, but Ray, I'll check my email when we're done here. So, any other questions before we wrap up for today?
Rich, did you have anything?
Yeah, I was just going to say that the exercise at Los Alamitos, not only do they want volunteers, as you pointed out, to moulage or have, blood and all this kind of stuff, artificial stuff, but they also want monitors. So if you don't want to get down and dirty, there is something else for you to do.
Awesome. Okay, awesome. Yeah, I wish I could go to that. It looks pretty fun.
They always have the fun stuff.
I know, they always have the fun stuff.
Yeah.
Alrighty, so, we got one more. Does this webinar count toward collaboration with the community? Yes, so that's why we put out that agenda under handouts so you can keep track. So again, when you explain this webinar to a surveyor, say that the Long-Term Care Association sends a representative to all of the DRC meetings and then brings back the relevant information, and we do this informational webinar, you get continuing education for it, and we have LA County EMS's representative present on here as well.
Yeah.
So, and if they challenge you on that, then definitely let us know.
Yeah, we haven't had anybody give us any feedback that the surveyors were not accepting that portion of it, unless folks are not keeping the paperwork and stuff like that. That's this is since nobody from licensing is double checking your work, they're not calling the coalition to make sure that you showed up. in order to be compliant with this specific tag, you have to have the paperwork to show that you've attended. That's the only way to show the proof of compliance with that rule. So.
And Elaine from LA County EMS, she wrote a comment on here just confirming that ReadyNet can send out information via text. You can read the messages on the phone app or just by being logged in. So you can see them through the app or on the desktop version as well.
And I think that if you have an account, the ReadyNet app is the way to go because it gives you all the functionality built right into an easy-to-use interface.
Right. You can answer the service polls or the bed polls all from the app.
Yeah. All right. Well, thank you guys. Thank you so much. We will see you guys very soon. If you have questions about getting signed up for the next seminar, just email us, and as soon as the registration is open, we'll register for you. So just email Jason Belden or jbelden@cahf.org or ckesterson@cahf.org.
Awesome. Okay. Again, if you have any questions, just email us afterward. And thank you very much for joining us.
Thanks, Rich.
Thank you.
Have a good
Thank
afternoon,
you.
everyone.
All
Thank
right.
you.